Today we're having the first of our series of webinars with County Executive Marc Elrich, and over 200 people have joined us today on Zoom, and others are looking at us on Facebook Live. And first of all, my name is Ron Halber, and I'm the Executive Director of the Jewish Community Relations Council of Greater Washington, and it's my privilege to serve in this capacity. During this coronavirus scare and pandemic, the JCRC has been working with government leaders, including our beloved county executive, and with Jewish agencies to ensure the flow of dollars to the Jewish agencies and to assist vulnerable populations, which are unfortunately becoming even more vulnerable. We are keeping our community aware of developments and pronouncements, and we are engaging in a great deal of interfaith work, making sure that our program is accessible to, especially to the socially isolated seniors and to others. For example, just yesterday, our Yom HaShoah, on Sunday, was live streamed and has been seen by over 7,000 people in the local area. Again, it's my pleasure to welcome our county executive, who I think his leadership has been exceptional. Marc and I are friends. This is not investigative journalism. This is a conversation between two friends and a lot of members of the Jewish community who are very concerned about what's going on. So Marc, if you would be willing to speak for about 10, 15 minutes about overall efforts in the county. I have a couple of questions that have come in, and then we'll open it up to everyone as well. And for those who are going to be asking questions, please remember to use your question and answer feature on the bottom of your screen. So Marc, why don't you take it away? And again, thank you for being here.
So thank you for setting this up. I've been doing a lot of these kind of community meetings via Zoom or via Teams, and it's actually really good because it's much better than a phone call. We're able to engage a lot more people in the community than we normally would, and you actually get to see people. I think that's a good thing. It's better than the old days when we just had telephones. So I'm happy to be able to do this. We are I guess we're a little over a month into this deeply. And what started as, 3 cases and then a period of like, it didn't seem like much else was happening, has now mushroomed into a lot bigger problem and a lot bigger issue. And I will say that I think that Larry Hogan's done actually a really good job. He stands out among Republican governors and to some extent among governors in terms of leadership he's provided at the state level on this. And I'm encouraged that he continues to talk about reopening, which we all would actually like to do. There's nobody who thinks that this is some pleasant vacation we'd like everybody to extend for us. So we all would like to get back to normal. But he's continued to talk about the importance of putting public health first in making that decision. And I think that's critically important. It will make it easier for the county, not just our county, but other counties, to follow suit if we have confidence that decisions are being based on science rather than being based on this, this desperation to open the economy. That we open the economy and then we trigger a second wave prematurely, it's going to be a real problem for us. So in the meantime, back in Montgomery County, we're in the midst of a lot of things. But I submitted the budget proposal on March 16th, and then the world basically came apart. And so obviously the budget we submitted is somewhat needing of change, but most of it was the same services budget. And we made some enhancements in areas like opening school clinics and additional money for counselors and things like that. And we're clearly, we're going to be stressed to do some of that stuff. And so I expect changes. And I had a tax increase in there, which was meant not to fund the general government, but to fund the school system request above maintenance of effort. And I think if everybody remembers, in the weeks that led up to this, everybody was in Annapolis talking about the critical need of putting more money into the schools now in order to meet both, Kerwin, which had laid out a vision for schools in the future, and the fact that this money would come in a year before Kerwin was fully going to bring funds to the county. So I think, that proposal is not going to happen. The council If they don't fund the tax increase, then they've got some relatively easy ways of matching those cuts. One is to take the 45 million that was above maintenance of effort and not spend it this year. And then there are some other things we'll work with them with, but we think we can manage this. We're also thinking that, you know, the whole point of accumulating over $500 million in reserves was to have that money for a rainy day. I believe we have arrived at a rainy day. It seems like a rainy month or two.
Mark, just to interrupt for a second,
Yeah.
how much of those rainy day funds, you said we have 500 million in rainy day funds, but how much is the county willing, do you think, sort of, is there a consensus how much it's being willing to use? Because we could end up with a $300-400 million deficit, correct?
Well, not actually. I mean, you know, this year is not going to be the worst year of this. We're going to lose.
Year.
We're going to lose revenues for a couple months of withholding. So you figure that we're going to get hammered in March and April, but as businesses start to open up, which I hope occurs sometime by mid-May, certainly by June, withholding should pick back up. Okay. The federal policy on unemployment is going to be a godsend to us in a couple of ways. And one is that they're going to allow gig workers, 1099, and self-employed people to apply for unemployment for the first time. And this goes live today. I heard last night on a call with District 20 that the governor said that the unemployment will fix those 3 areas by Friday. And so all those folks who've not been able to apply and told that, you know, don't even bother because the system will kick you out, they fix the system. And I say, don't blame, you know, I don't blame the governor for the delay, because you had a system that was in place to deal with the normal unemployment laws and to automate it. And then to throw in all these new categories and think of it as a massive computer system was more than just throwing a switch and saying, take these applications. So that's going to be good. But the real deal in this is that the federal government is adding $600 to a typical unemployment check. And so the average in Maryland was a $385 check. The maximum check in Maryland was $430. Well, this means that both the average and the maximum right now are going to be around $1,000 a week. That is serious money. It's actually more money than a bunch of people who qualified unemployment normally make. So for people who qualify for unemployment, they may well be able to meet many of their bills and their rent, which would not have happened on a $385 check. So this is
will that lessen the burden a little bit on the county government, because now that you have that, because otherwise would the county, you think, have had to step in a little bit in those areas?
Well, I don't know if it's going to lessen the burden. It may reduce the number of people I have to divide my resources among. And so when we're looking at rent assistance programs, we can focus now on the people who, unfortunately, because of our backward immigration policies and, you know, the continued refusal to deal with the fact that we've got immigrants who have been working here and will continue to work here, those people are excluded from all the unemployment benefits. No matter how you slice or dice it, doesn't matter whether you're gig, self-employed, or anything, you don't get it. And so this will let us focus our money on those families, which are basically earning little or no income right now. And we think there, you know, going to be serious hunger problems in that community. There are going to be very serious housing problems. There has yet to be any agreement on people actually foregoing rent from this population. And so everybody's fear is not the, after the coronavirus, is that somebody knocks on your door and says, you owe me for the April and May rent in 2 months for which you might not have had income. And that's going to be a huge problem. And if those evictions then get processed, then you can wind up displacing an awful lot of people. And as we know, there's no place to go. I could move 10,000 people out of apartments tomorrow. There aren't 10,000 vacant apartments waiting for people to move into. So we're hoping, and I've been talking to the governor about this, about broadening support to include the immigrant community so that the effects of that are minimized. The other bit of good news coming out of all this is the federal program. Hopefully they'll get over their silly bickering and put more money into the PPP program, and hopefully they'll prevent hotels and large restaurant chains from bleeding that program dry, as apparently happened in the last go round, and get that money to, to the really small, medium-sized businesses.
I can add, County Executive, that a lot of Jewish nonprofits applied, and a lot of Jewish and while several got, only about 50% received so far because the money was exhausted or because of the competency of the bank that you worked with. And so the new, what are they talking, 300 billion or something?
Yeah, 350, something like that.
Right, rounding errors, right? As soon as they're so we're hoping, and we've seen a lot of non-Jewish nonprofits that we work with also not get the PPP protection program, payroll protection program. And, for them, this is serious. This is a ability to meet payroll and keep people off of unemployment. And so I think a lot of people, I just want to ask you one question. If you can say, so you think you think it sounds like it'll be tough making it through the end of the fiscal year, but there's some relief. But then what your real concern is the upcoming year. Is that correct?
So I guess my concern is two things are going to happen. One is, if people with vacancies will submit for reassessments and their property values will go down. We are going to we've got a major tax problem in this county. We can talk about it later if you want, but our property tax system is completely screwed up. And a decline in assessed value will not only affect us this year, but will affect us every year going forward. And it's what's put us in this kind of downward spiral that we're in. We need to fix the 1990 law. That's my big concern. And then the income taxes are going to largely depend on a couple of things. And perversely, if the market recovers, which it's shown signs of being able to do, then we don't take a huge hit on capital gains.
Right.
And so instead of having a huge hit, people could make a boatload of money by buying stocks at the bottom and selling them on the way up. And I think smart, savvy investors probably had good bailout strategies for the trip down and will be in a position to benefit going up. So maybe we don't get killed as badly on capital gains, because this should not be, if you think about before this happened, this was a full employment economy. The jobs weren't as good as they were before, but it was a full employment economy. You should be able to get businesses up and running if you do the right things, which is why you're talking about the PPP. That's why that program is critically important. And if you're a business person out there and you didn't apply last time, you should get online and see what the requirements were and be ready to push the button the moment that is reopened, or to get to a local bank and make sure your applications are in, because a program that guarantees employment is actually the best program of all, because if you keep people employed, they're going to pay your rent and your bills and your wages. So your employees know who they're working for when this ends, and you know who your employees are when this ends. This is much better than a cold reopening. So I'm encouraging people to please take advantage of this program. It is the best thing going. And if it doesn't work for you, even the loan program, I've heard good things about from people who said the loans are very low interest and very long term, and that the hit in the over a short term is much better than any kind of regular commercial loan they would have gotten. So I have reason to hope. I mean, there's a part of me that thinks if we just could do this right, if we had, just a rare moment of political unity, and if we could focus on making sure that businesses had the capacity to reopen, we could get a pretty good bounce from it. And if we take all the lessons we learned this time, and when the coronavirus revisits us, which apparently it's likely to do, we can actually do a whole bunch of stuff on day one that would minimize the spread of the virus, which then minimizes the depth of the impact. We don't have to repeat this. Having gone through this once, we should be able to handle the second version of this better than we were able to handle the first version.
Yeah, County Executive, you want to talk a little bit about, you talked a little bit about the federal efforts and how that has the potential to alleviate some stress on the county budget, state budget, and all. There's discussions in Washington that there might be a fifth coronavirus package that Minority Leader Senator Schumer, who I worked for eons and eons ago, is working on perhaps a package that would actually help states and therefore counties with their budget deficits. So you've got that, you don't know when it's going to reopen, you have hope, we have pessimism, we have optimism. your budget that you submitted ago, I've spoken to a few council members, they're just like going, oh my God, we almost have to start from the beginning. There's no tax increase that people want to support. How do you get this revenue that we're going to desperately need when people are saying no new taxes?
There's a lot of hyperbole engaged in this. So, I mean, think about it this way. The tax increase was solely focused on the schools.
Okay.
So if you don't pay for the above maintenance of effort, then the delta is a much smaller delta.
Right.
The county is spending a lot of money right now, but a lot of that money is reimbursable. So we haven't even gone into our reserves yet. We've been able to manage this crisis in this year out of our existing budget. We know we'll make some transfers, but with $183 million right now coming in from the feds, not counting what's coming forward.
The current fiscal year budget.
The current fiscal year. We're able to fund a whole lot of stuff with a relative certainty that we're going to get that money back, which means I don't dig a hole this year and I'm not digging a hole next year. So the estimate on revenues for next year, was under $100 million loss. And if you have reserves, that's what they're for. So I could either cut $100 million out of programming, and I just want to make this clear to people so they understand what this means. When you take the county budget and you knock out the schools, you've just cut the county budget in half. And when you knock out debt and the retiree benefits and all that stuff, that whopping $6-something billion budget winds up being something like $1.3 billion. And when you knock out money that's in that budget that comes earmarked, in other words, we get this money and we have to spend it on certain things, my fungible budget is something like $935 million.
Out of six.
Out of six. So cutting $100 million, you're not doing that without doing serious damage to the services that people in this county depend on. And my choice, and I hope it's the council's choice, is to go into the reserves. And if it's a $70 million hit we take, or a $100 million hit we take, we pull it out of reserves so we can make sure that residents get the services that they expect and that life is as normal as possible here. And then we start rebuilding our economy, which is what I'm hoping that if the congressional action does what it should do, we should be able to do that. And I do want to I wanted to say one more thing about the unemployment thing. I checked online, and the beauty of unemployment is it's taxable, just like people's income. So the income that's being replaced is going to be taxable just like the income they had. And so having $1,000 in taxable income as opposed to $385 in taxable income a week means that in some ways this is going to be less painful, for example, than the unemployment wave that hit us under the economic sinking of the Titanic. When we all first came in, around 2008, 2009. So I'm a little bit more optimistic because I can see a way that this can be managed so that we don't have a massive collapse.
This is the most optimistic. It's the most optimistic I've seen you since the crisis began. I've been on quite a few Zoom calls with you. It's nice. But I keep watching.
Look, I keep watching things unfold. I mean, who knew that Congress would pass the kind of legislation they passed? Nobody thought that showdown there would manage to get this done. And then they did version 2. And so they continue to show willingness, and if only for political expediency, and frankly, I could care less what their motivation is, as long as we get the money and we can get the economy back up and running. Whatever motivates them to do that is a good enough reason for me.
Well, I'm going to go ahead and ask you a question or two now. And now we're about at the 12:26 point. And I'm going to ask those of you who are listening in to please start putting your questions in the question and answer section of your box. And if they haven't been repeated, and as long as they're original, I'll pose them to the county executive. I wanted to start with a question that might be of particular interest to the viewers on this call. I don't know, county executive. Excuse me if I go back and forth between county executive and Mark.
Mark works.
Mark works. Thank you.
Yeah.
Mark. I don't know if you had heard that there was an anti-Semitic attack at Tikvat Israel with graffiti put on the windows. And what happens, as we know, according to history, is that whenever there are unsettling times, economic, viruses, whatever it is, stereotypes begin and people get blamed. And there is, as well as a pandemic of viruses, a pandemic of racism, anti-Semitism, and bigotry taking place online. We were, even before the coronavirus, we were on a tremendous upward swing. The number one targeted group of all religious-based crime in the United States is Jews. This is reflected in all the local area police statistics, Fairfax, DC, and Montgomery County. And so there's been all these conspiracy theories that have been that have blamed Jews in countries, Israel, and China and Chinese Americans, and as far as the Jewish community, that the Jewish community has actually made the virus, is manufacturing it, and is actually expanding it so they can use to gain their influence. And I'm just wanting to know, in our small section of I know, in our small section of it's unbelievable. In our small section of the world here in Montgomery County, what can Montgomery County do, either through the bully pulpit of leadership or whatever it is, to make our Jewish citizens and others feel at home and to protect them? Because the need for security is real, even as the pandemic virus goes on.
So first of all, I feel like, the police have to do their job to track down and deal with any act of hate, regardless of who it's targeted against, and to basically take that we're not going to put up with this approach. It's no longer, I'm taking the report. Well, I don't think we've been past that for a while, just taking a report and filing it. We need to actively and assure the community we're going to actively pursue anything anybody does in this regard. But I think in the long term, the biggest force we have in this county is the voice of leadership in the community saying that we're one people, we're one county, and we're all moving forward together, and not picking winners and losers and not scapegoating one portion of the population or the next, but saying this is who we are is a community that's welcomed everybody in here, has made it possible for everybody to find a home here, and this is who we're going to continue to be. And I think the good news is, our political leadership is united in this, whether it's at the county level or whether it's our folks at Annapolis or folks at the federal level. There is no break in the unity about the message that we try to send in Montgomery County. And so we're going to keep sending that message. I think you have to reinforce for people that there's no scapegoating that any of us are going to be a part of. And,
I will tell you,
it's scary.
I agree, and I will appreciate that. I've been working at the JCRC for a long time, and Chief Allen. Marcus has been fabulous, and every time we have had an incident, not only have the police gone out and made a report, but they have spent time really gathering. I think this started very much under Tom Manger and continues.
Yep.
And there's a great sensitivity that the county because when we work together with our partners at the Federation through SCAN, which is our security at Federation and JCRC, to deal with these incidents, and our friends at ADL. And we have found, and because I deal with our JCRC directors around the country, and I will tell you that we have, I think, a model police force in terms of their response. And it's not 100% uniform and always every time, but the overwhelming majority of the time, I think people are doing well. Let me ask you, there was, I know that in this budget you were providing for increased security dollars for Jewish institutions and for Muslim institutions, and I was very grateful for that. Do you where does that fall into this discussion? Is that something that is on the table? Something we're going to have to think about? Something we're going to maybe have to adjust? I mean,
I'm hoping not. Look, I mean, there are some things in this budget that I don't want to touch. We made an additional commitment to affordable housing, and I try to remind people, at the end of the day, when this stupid virus goes away, we still have a county to run. And every problem that we had before, we have now. Right. Anything we were trying to deal with, whether it's, public safety for religious institutions, whether it's affordable housing, whether it was our efforts to expand daycare, those issues are going to be there tomorrow. And to the extent that this budget can continue to address those things, I don't want to take a wholesale approach and say, oh my God, the sky's falling, let's shrink ourselves to the lowest thing we can be, and then try to put this back together again, because that's going to be extraordinarily difficult. So I'm going to work hard to preserve things that I think reflect our values and our effort to respond to challenges that were very real on May 15th and March 15th, I mean, and make sure we're able to deal with them going forward. So I think at this point that we can manage this budget to get the council what they wanted, which is the same services budget. And I think when they actually get to see what's in the budget, but most of it's same services, and where we expanded things, we expanded stuff that had largely been agreed upon by the council. For example, we've had new hires for all these health clinics. We were opening health clinics at high schools. We built the thing, we anticipated staffing them. We're going to expand early childhood. So we're trying to do that. We're trying to deal with overtime in the fire department. It costs money, but it ultimately will save money in overtime. So I'm going to fight for things that I think, reflect our values and minimize the damage.
Right. There, one question that I was today that somebody, and I'm giving people an opportunity to load the queue with questions, is we're getting some good ones. Is two issues. One is the issue of racial disparity. This coronavirus has hit African Americans and Latinos in the Latino community in Montgomery County and around the country in disproportionate numbers. That's just clearly detailed by information from Johns Hopkins University and from others. And I'd just like to know, what are your thoughts about that? Do you want me to give you the second question at the same time?
Yeah.
Okay. And the second question is, so the first one is about racial disparity in the coronavirus. And the second one is that domestic violence hotlines are lighting up, and the need for shelters for women and girls is going up dramatically, because mostly women and girls are at home with the men 90% of the time who are doing the abusing. And has the county taken any additional measures to try and safeguard this population? So first, the racial disparity question, and second, the domestic abuse question.
So I am not at all surprised by the racial disparities that we see impacted here. And I feel like if people had their eyes open and realized what's been going on in this country for 300 years, people would have been able to put two and two together. So if you know that you've got a population that has all these underlying health issues, hypertension, asthma, diabetes, many things attributable to lack of healthcare and lack of access to healthcare, and the stress of, frankly, being an African American all the time and having to wonder what people think about you. And I've said this before in meetings. One of the things that's most notable about when you think about why we put this focus on African Americans is that, I tell people, I said, I've never in my life thought about being white. I never went to a job interview and said, what do people think about a white guy? I never walked into a store and said, my God, these people are going to be looking at everything I do because I'm white.
You talked about some of this in your inauguration address.
Yeah. So imagine always having to think about that, and then what the stress is that builds on people. So this doesn't surprise me at all that a population with a large number of underlying conditions is going to be especially hit by this. They apparently don't go to the doctors with the same kind of regularity to some extent. And so we may be seeing people who've allowed the disease to progress further at home until the point they go to the hospital. It's gotten harder and harder to treat. And so to me, it's not unexpected. It does I think it does call out the need for us to come up with some real healthcare solutions. We've got to crack this nut so the color of your skin or your income is not a determinant of what kind of healthcare you get in this country. Most civilized countries don't have that kind of disparity. America is one of the unique ones. I mean, we used to say, America and South Africa were the two countries that had these unique characteristics, and now it's just us. So, it's time for America to join the rest of the civilized world and have a civilized healthcare policy. On the domestic violence issue, we're actually rolling out something later this week. I think it's planned. We met with folks from some of the groups that deal with domestic violence, and we are going to talk about and have a campaign and maybe include things on buses. I haven't seen the final flesh out of what it's going to be, but talking about domestic violence and, particularly in these times and where people need to go for help. And we'll certainly, I'm not going to be telling people to go back to their abuser if they really need shelter. We're going to have to deal with the shelter issues for that. So I think this is really important. I will say, people have said to me, so why did you guys leave the liquor stores open? And my answer is something that one of the people in a hospital said, one of the senior execs from a hospital said, because I had supported this, and my reasoning was that I worry about alcoholics going through withdrawal. And if there's no alcohol and an alcoholic goes through withdrawal, they can become dangerous, they can become violent, they can become more unstable than they already are. And withdrawal is a horrible process for a person to go through. And what the hospital person said is, and I don't want my beds taken up with alcoholics going through withdrawal at a time I'm trying to fill the beds with the people who need help from COVID-19. And I think that's simple, straightforward answer. This, the stores are open because we're trying to minimize the number of people who are going to wind up increasing domestic violence and potentially winding up using hospital beds.
Let me ask you, and this is an interesting question that just came in, considering how many years were you a teacher, Mark?
17.
Yeah. How do you think the county's long distance education? My daughter woke up for her 9:30 fifth grade Zoom math call this morning, and it's a whole new world. And just as a teacher, not as a former teacher, and as the head of our county, what is your assessment of how we're doing in that regard?
So teaching? I'll be honest, and I don't want anybody to shoot me. I think at the high school and middle school level, it's a little easier to do online learning. I mean, assuming the kids are tuned in, assuming the parents who probably aren't working or around to make sure the kid is where they're supposed to be, this could actually be done successfully. Some things are harder to do than others. Elementary school kids, which is the level I taught at, that's a little bit more concerning to me because it requires a lot of hands-on. It requires a lot of individualized instruction. If you're say doing math with younger kids and you're working with manipulatives, well, there are no manipulatives on TV. You can't go up to the board or take the kid up to the board and say, let's work this thing out. So I think it's a little bit harder for elementary school. And I think that's just a reality of it. I think everybody's doing the best they can, but there's no playbook for this. There's no country where education is done this way. So you can't even say, well, this is our model and we're just simply going to introduce the model of X very successful country. You have to invent it on the fly. And the curriculum, if you looked at the lessons, particularly elementary school lessons, they have a lot of interactivity, and that's hard to accomplish this way.
By the way, there's an email from Rabbi Marc Israel, who is the rabbi of Tikvat Israel, who said, the Tikvat Israel community is so grateful for the assistance the county provided us following the attack on our building, as well as for the diligent police work that led to the arrest of the perpetrator. In addition, the response of the general community has reaffirmed our belief that this is one of the most open and diverse and welcoming counties. So there you have it from the source. Let me see what we have questions we have. Okay, I have, this is from an anonymous question. I have a loved one at an assisted living home in Rockville and don't understand why they are not testing residents with symptoms, just keeping them in isolation, which they are already doing for all the residents. Therefore, they report 0 for 0 positives, while there are workers there who have tested positive. Please comment.
So despite what the president says, there aren't 8 test kits. And Hogan's made that clear repeatedly. I mean, it's not like people aren't out there trying to do testing. We just don't have the kits available to do testing widely until, and even with what Hogan brought back yesterday, we need the machines to be able to run the tests. So for example, the hospitals were had test kits and were running tests, but it was taking 4 or 5 days for them to get results in some cases. Not because the test took 4 or 5 days to read, but between the time it got sent out and processed and the results sent back, a lot of time passed. So the county is no exception. We have a limited supply of tests. When, you know, that first outbreak when they went to, somebody was at a senior center, one of the first 3 people.
Rockville. Yep.
And so I remember literally the phone call with Dr. Gales, and he says, I got an envelope with 31 tests. 31 for the county. I'm going to take 16 over there and use them. That'll leave me with 15. We are making choices we do not want to make. And the fact that doctors are being forced to make this decision to evaluate based on no test other than symptoms, whether or not you're worthy of getting a test is a reflection of the limitation of the tests. So,
any idea how many of those 100,000 tests, 500,000 tests are on the way to Montgomery County, and whether we have those enhanced machines available to, whether we have the machinery to process it faster?
So we did not have an answer to that question this morning. Dr. Gales is actually working with a company that may have testing capacity. I have raised the issue with him because I also have the ability to buy tests. And I've asked him, does he want me to go ahead and pull the trigger and buy both serology tests and the virology tests? And if I get an answer like, yes, let's go ahead and pull the trigger, I'm going to go do it, because even at the state level, 500,000 tests is probably not enough. And some people, and you know, to some extent, you need to do retesting. What I would like to be able to do is, you know, test everybody in a senior center, any of these rehab facilities, so that we know both people coming in and what patients are exposed. Anytime we have a reported case, I'd like to be able to go through the network of reported contacts and be able to run tests quickly rather than waiting for somebody to become symptomatic, because the point you've identified them as symptomatic, they've been spreading. And I just feel like this is, you know, this is one of those, is it draconian the right word, or there's a word for these unpleasant decisions? But, you know, without the right resources, you're doing a process that is sort of like tries to minimize the damage, but can't assure that there's no damage. And so as rapidly as I can alter this, I will. If I get the approval to go ahead from the health officers that we should go ahead and get our own testing, I will do that in a heartbeat. And I've also looked at machinery, and I'm perfectly willing to buy machines. The truth is, we're going to get largely recompensed by the federal government. And I think this is the kind of expense that we should be making. So we're having an ongoing conversation.
So a question from Marla Schulman. Can the county executive please give us some info about the status of the pandemic in terms of number of cases and the curve?
Let me see what I've got. So statewide, cases went up 509 yesterday. It was 801 the day before, so it's obviously a decline. Montgomery County's cases stand at about 2650, right around there. And the deaths are, I think, up to 90 now, 89 or 90. So that's where we stand. The decrease from yesterday is good, but we had another decrease earlier, and, you know, people asked Travis, does this mean we're over with this? And the day after we had the decrease, the cases doubled. And this is the thing that's going to happen with more testing. As soon as we start testing, the number of cases are going to go up. There are apparently a large number of people who are asymptomatic or may get this in a way that it's mild and it's not life-threatening, but at the same time, you're spreading and could be spreading to somebody whose life will be threatened. And as we do more testing, we're likely to see more positive cases. I would rather take that bad news and be able to then deal with the folks who have tested positive than be limited to the testing we have now and watch our numbers go down, not knowing whether that's actually a true reflection of what's out there in the population.
Here's a question from Lori Yaffe, and everybody, please keep your questions coming on in. The county executive likes these questions, and I've never seen him not able to answer one, and I've never seen him be stumped. So here we go, Mark. What steps should the county take to help residents who are experiencing furloughs and are unemployment find opportunities for retraining or alternative employment, or to find new opportunities in the market? It's an interesting long-term question.
That's definitely a long-term question, because there's no alternative employment unless you want to go work, I guess, for some of the grocery stores or Amazon, or having a field day with, moving food in and out, and Amazon shipping a boatload of stuff. But most businesses aren't in an expansion mode right now. I guess, this is why I'm very focused on the kind of aid packages that are coming out of Congress, and, also what the county's going to put out there, because we want the businesses to reopen. I don't want people to have to get retrained because all these businesses close. I want these businesses to reopen. It is so important, because it's not just the collapse of the businesses. Think of all the people who own the real estate and the shopping center these businesses are in. The loss of businesses destabilizes everything, not just the businesses themselves, but everybody else who depends on those businesses. All the suppliers. If I lose, 10 outlets in Montgomery County for a product I sell, that might have a significant impact on my ability to produce and successfully operate whatever business I have that's providing those products. Right. So I would like to focus on getting these businesses reopened and taking advantage of the federal money to do that. That's my pitch.
This is an interesting question. How is the county health department checking that nursing homes are following all the health rules? And obviously, and I had a private conversation last week. About 10 days ago, my father passed away in New York. He was in a nursing home. His death was unexpected because he was doing relatively well. He did not pass away from COVID. But at the nursing home that he was in New York, there was about 250 beds, and 70 people have now died from COVID in that facility. And when we talked, I think about 5-6 days ago, Mark, was like 50. So, but that's different because New York is just the epicenter and has like 40% of all the cases in the country. It's a madhouse. And from all my friends back there, it's terrible, the stories I'm hearing coming out of my family and friends living in New York. But what are we doing here local? How are our nursing homes doing, and how are we making sure not only that they're following the rules, but how do we make sure that they and all the other nonprofit providers are getting the PPEs, the personal protection equipment that they desperately need for their own services?
So we've done a couple of things. We've worked with them to identify what their PPE needs are, and we've helped supply them with PPEs. I know everybody heard about the governor's task force or strike force on nursing homes.
Yeah.
What Travis Gales pointed out to me, Dr. Gales, our chief health officer, was he actually started a strike force on nursing homes 2 weeks earlier in Montgomery County. Okay. So he gotten on top of this early. So we are working with them on supply, and they've been going in and looking what their procedures are. Now we've got the state, working on this as well. We're going to continue, to make sure we can provide backup supplies if they're not able to get them. It's not always easy for us to get supplies. Our folks have chased more rabbits probably than they've been able to hunt, because the stuff evaporates before your eyes. It doesn't get delivered, or suddenly the terms keep changing, and so we've chased a lot of stuff and not always gotten what we wanted. But we're going to, continue to work on this, and just so everybody understands what I've directed our people to do, and that is that I've told them, you need to accumulate enough PPE and other relevant supplies to deal with round 2. Do not think about this in terms of what do I need for the next 2 weeks, or what do I need for the next month. It's what do I need for the next year. If this comes back, what are you going to wish you had when this thing pops up again? I do not want people going shopping. It has been painful. It's used an enormous amount of time and energy to try to trace things down. And for the next round, we're going to get ourselves stocked up so that when it does come back, we've got the masks for our employees. We've got supplies for people who will turn to us for supplies. We're not, trying to commandeer production of, whiskey in order to turn it into hand sanitizer. I'm sure you appreciate that, Ron. It's a tragic waste of whiskey. We should have had thousands.
A lot of distilleries have gotten into this business, which I
thought
it was brilliant.
It's a very good business, but but the quantities they're able to produce doesn't really get to where we need. So we're still looking for bigger stuff. So I've got my short term is to supply us. My long term is to supply us enough that we're not visiting this problem again.
And I encourage people, we have the county executives till 1, and then we're gonna have to let them go. I encourage you to keep asking questions. How are our hospitals currently right now in terms of their supply of masks, gowns, respirators, and ventilators? How are we doing on the front lines? Are we generally stocked okay for now? I know we burn through them quickly. I know that you put on a mask, you use it, you get rid of it. Wear a pair of gloves, you use it. Are we holding? I mean, obviously nationwide we're in supply. You hear about donations and emergency packages. Every governor announcing that they got some from abroad and some deal. Where are we in our own home community here in Montgomery County? Are we holding the line okay for now?
I think we're holding the line okay. I've had a conversation with the heads of the hospitals last week. I said, is there anything you need? Most of them felt like they were able to deal with their supply chains to their regular suppliers. But we did, for example, bring in ventilators. Ash Shetty, who's my procurement director, found ventilators and was able to bring them in. And we're continuing to look. We may bring in more ventilators. So we're trying to find what supplies that we know they're having a harder time getting, and ventilators are one of them, and continue to look to be able to supply them. Again, because we know we're getting backed up by the federal government. This is of no consequence to me. And, looking at deals and saying, don't do it, what am I going to do for the money? I know what I'm going to do for the money. And if you don't spend it on this, you got to give it back to the federal government anyway. So there's no reason not to spend it on this. So we're working with them. We're going to continue to work with them. Hopefully, the supply chains will get worked out for everybody so that they are able to get things more easily. But I will say one hospital, was talking about their machinery, and they said, as of last week, they had 3 machines that can read the PCR tests, which are the viral DNA tests that you want to be able to use. And he said they've got 3 machines. One machine, they've got enough tests to run enough reagents to run 350 tests. They have 2 machines for which they have no reagents and can't use the machines, which is a bottleneck in their supply chain, and not one that I have a better set of contacts than they normally would, because they're dealing with the manufacturers who sell the machines and sell the reagents, and they're struggling for that.
Do you know how many manufacturers of these machines there are, or are they all coming from one source? Or
there are a bunch of different machines. They have very different capacities. So a lot of hospitals have machines that can process, if you ran them 24/7, maybe a couple hundred tests a day. But that's if you run them 24/7.
Right.
And that's the lowest scale that we need. Other machines, if you've got 1 or 2 machines, don't produce very many tests at a time. But you got to think about it. A hospital wasn't designed to run, hundreds and hundreds of virology tests a day, because you need it for a patient who's got a virus normally. Out of your 200 beds, not everybody has this. And so their machinery isn't designed by and large for high throughput work, where you need to be able to pump out mass quantities of assessments. And that's why, we found one company that Travis is working with that apparently has got some higher capacity. And I'm going to talk to Travis about that discussion later this afternoon to see where we can go with that. But I am very focused on getting us capacity.
I just got a question from Bob Arkin, who's a board member of ours at JCRC. He says, what do you think about a moratorium on rent increases in the county in general to help renters or people who may not be economically in a position to deal with those increases now due to the COVID virus?
I think a moratorium is fine. If the industry itself would like to self-announce that they're voluntarily doing that in order to escape legislation, I'd be happy with that too. But people are going to need help, and if the recovery is slow, there's no guarantee that these enhanced benefits will last much longer than what Trump deems to be the end of the emergency. But the economy is going to be an emergency for a much longer time if we don't get people back to work. So I don't think it's a bad idea. I told Will I'd support the bill. If somebody's got another way of getting us there without a bill, then they should bring it on and tell us this is what, what's been agreed to.
So
I'm not looking for a fight. I'm just looking to help people.
Right. This is a question that's a combination of federal county resources. What is the county doing to make sure that residents on SNAP, many of whose disabilities, can have groceries delivered? SNAP does not usually allow to pay for grocery delivery through food stamps.
I think some work has been done on this, and to allow, basically, I think that that's being addressed, to allow people to pay remotely. I know they used to have to go in. You could use your credit card on the phone and buy groceries from Giant. You couldn't use your SNAP card on the phone. I think that's being relaxed.
Okay. Let me ask you a question. What does obviously you've mentioned that you've had some good coordination with the governor. Two questions. How has the regional cooperation been between Fairfax, DC, and Montgomery County? Like, how much in terms of, have you dealt together with this as a unit, or have you done it in one geographic area, or is it how much cooperation has gone on there, or if it's even needed? And secondly, what does an opening of the following the pandemic look like to you over a sustained period of time?
So the coordination is largely taking place at the public health official level.
Okay.
And so that's been going, I think, pretty well. They compare data. They're talking about, I think everybody's got a common set of values about what should the conditions be for lightening up. I know in the state, I'm on a call every day at 2:00 with all the county executives of the big 8 counties in Maryland. And we've been talking jointly about what our issues are and what we need the governor to do. And I will say that we've often proposed some things and told the governor through our liaison that we think we ought to move in this direction. And then the governor has moved in that direction. I think, what I thought was important, because we are in an overly political time. There are people who would make politics out of a crisis, no matter what. And there are some people who deserve an awesome amount of blame, but just basing, this on whether you got a D or an R in front of your name, and that alone is not a very good way to go about dealing with this crisis. And so, we've tried to reassure the governor that if he takes some of the steps that we thought were necessary, that he's not going to get blowback from us. We're not going to be sitting there second guessing and saying, well, you should have kept these things open, you should have done that. We're more or less coalescing in pretty similar positions on things. Our law on masks or face coverings requires that businesses provide a face covering. The governor's requires that workers wear a face covering. But when I talked to the governor, he said it's not his intention for his order to override our order. And that, in fact, we know that before they issued their order, they asked us for a copy of what we did. So we've actually had a really good relationship. Steve Hsu is the governor's liaison. He has been very good about running things, as he likes to say, up the flagpole. Some things get saluted, some things get contemplated. But overall, I think it's been pretty positive.
So the last question, because I am being told that that we have to be, not that I wouldn't know this, but I know that we have to be respectful of your time, because I assume, how many Zoom calls a day are you doing, Mark?
5, 6, but Zoom's not all of it. I was on the phone last night, I think, till 11:30 or 11:40.
Oh, okay, all right. Only 5, or is that before breakfast? All right. So
I can only get 3 in before breakfast.
Only 3 before breakfast. Okay, that's good. Although you've lost a lot of weight, you look good. You're keeping on that diet.
Yeah, 40 pounds, blood sugar, even though I'm on medication, but totally normal blood sugar. If I went in and I had my blood sugar tested now, somebody would say, you're in perfect health and you don't have to worry about anything. So
you're the only person I know who's lost weight during the coronavirus. The joke is that the mask is not for the coronavirus, but to stop people from eating at home.
I lost weight between Thanksgiving and Christmas, which I consider to be a major feat.
Well, we had Passover,
that's usually
which
the
was
time I
hard.
put on 10 pounds.
Right. And Passover didn't help for a lot of us. So let me just end up with one final question and then give you a chance to wrap up. What does a rollout, what does a opening up look like at the county level, or where do you, I mean, obviously we can't project where, because you've made clear that you're following public health and science and not politics. And that's what I think most people would agree is the smart approach. The coronavirus doesn't affect people by party affiliation. It just attacks people everywhere. So we should be attacking this as not a political matter, but a public health matter based on the best science available to us. I think we're lucky also that we have Johns Hopkins right here in the state, which is actually probably the best private facility in the world that's been in terms of chronicling the and keeping us total. That's certainly one of the sources I go to besides the CDC. What does a reopening look like, Mark?
So the ultimate reopening will be determined by the public health officials. So this is the discussion that we're all going to have together. The lessons I've taken away for this are if we had gone to face coverings as soon as coronavirus is reported anywhere near the state. I don't mean it has to be reported in the state, because remember, you can be asymptomatic and come in here. I would have done face coverings from day one, because what it would have done, and you got to, let me explain this. The face covering we ask you to wear offers some protection to you, but not nearly the protection of the medical mask. And we don't want you buying the medical masks because there's not been enough of them. We don't want people devouring the supply that's meant for our healthcare people. But that said, if you maintain 6 feet distance and if you have a face covering, you are less likely to get exposed. But the big thing about the face covering is if you wear a face covering, and I personally prefer a mask to a bandana because stuff can't come out from underneath it, is that if you sneeze, if you cough, or if any germs come out of your mouth, virus particles come out of your mouth, but if you can watch a disgusting YouTube video to see all the stuff comes out of your mouth when you breathe, and that was pre-coronavirus. What you want to do is stop the spreading of the virus on surfaces that other people unwittingly touch. And I think if everybody had been walking around in masks, and if we had been wearing gloves, we could have touched things, gone home, taken off our gloves, sanitized our gloves, and not had the level of exposure. Our masks would have kept us from spreading it if we were asymptomatic, and you can take your mask home and you can actually wash it in a washing machine or in hot water with soap. So I think that's one thing that may stay with us a while, is the notion of some distance and the masks. I think if we can get testing done widely enough, then you could have people who've been cleared, and you could have a card that says you're cleared. And that's important because it lets us know who's possibly got antibodies and who doesn't, who's already had the virus, who's less likely to get it again. There's some reports about reinfection, but they're not confirmed yet.
Right.
But certainly not at the level that it was. So whatever's coming back the second time, it doesn't seem to be going through the same way it did the first time, if that's what's happening. So I think if we could get the testing done, that would allow us to have, different requirements for people depending where they were. If you're completely asymptomatic, have no virus, and have no history of it, you're probably the most vulnerable. You might want to wear a mask just because you're the most vulnerable.
Right.
But I think, that a series of those things could be very useful. You could allow people to go to restaurants. You probably need to put more spacing between tables. So maybe restaurants, for the time being, would have to reduce their occupancy a little bit so there was a little bit more space. I'd expect my waiter or waitress to have a face covering. They'd probably want me to have a face covering. There are a lot of things that we could do that would lead to more normal. I know in my workplaces, I would have been able to open them up with face coverings and sanitizer if those things had been available on day one and people had a confidence level that this was going to help them, as opposed to bringing people into work and just hoping that they don't get in contact with this thing. I cannot tell you how painful it is to know that people are doing things that put them at risk, and you don't have the ability to deal with it. You don't have the sanitizer and you don't have the masks. And I guess it sucks. It really does.
Right.
You know, it just weighs on you because, you know, in a better world, in a better prepared society, we could have managed this so much better. And then I think,
all the measures you're talking about are just common sense. Just common sense.
I think so. I mean, I think we would look at the jurisdictions of the countries where they seem to get a handle on this early. And I remember watching pictures of people in Taiwan walking down the street with masks and gloves and walking hand in hand in the street, having a fair number of people on it and people going shopping. You can do this if you're adequately protected and you're able to adequately protect others. So it's not just about you, but it's about other people. So I do this little video where I said, you know, your mask protects me, my mask protects you.
Right.
It is a mutual protection device. And I think if we can do these things and not get freaked out about it and not feel like, you know, you're imposing terrible things on my life, we can get through this until they get a cure, which is obviously the gold standard, and get a vaccine, which may take a little bit longer. Cures may come faster than a vaccine. And when that happens, maybe this becomes like the flu, but, you know, I got to remind people that flu kills tens of thousands of people here a year.
Despite the vaccine, right?
Despite the vaccines we take.
So out of respect to your time, County Executive, I want to wind up. I want to thank you very much for, number one, drawing a huge crowd here on Zoom, and drawing, I don't know, but I'll let you know how many people were on Facebook Live. I think many people appreciate your scientific and public health, using science and public health to guide your policies and your procedures. Appreciate your measured and effective leadership, and your determination to continue to make Montgomery County a safe place, but to do so in a way that protects our community. We thank you for all the energy, the passion you're putting into this, and for making yourself available to the Jewish community and beyond. And with that, I want to wish you Godspeed in all of your efforts to protect our county and to protect our community.
Look, and I'm happy to repeat this again. I mean,
we will take you up on that offer. Don't worry.
Not every day, but, you know, timely check-ins wouldn't be a bad thing.
Timely check-ins. We will be more than happy. And thank you for making yourself available, County Executive. Best wishes. And thank you for everybody for being on this call, the first in a series with our county leaders and with on other topics of Jewish interest and concern, which you'll be notified in coming days. Everybody stay healthy and well. Take care. Goodbye.
Thank you.